Hey guys, John Adamson, the Rehab and Documentation Guru. I'm going to talk about a scenario that I've never faced before in 30 years of clinical practice. Of course, some of this I wouldn't have faced early in my career. So, as you know, when you get ready to discharge a patient, the patient has some rights in terms of appealing the decision to discharge. And in home health, they have that right to not close out their home health activity, and they can appeal to Medicare. So we issue them a notice of Medicare non-coverage, and Medicare has 72 hours to respond to them with a decision. And usually, what ends up happening, in my experience, is Medicare will get back to them within that time, but because they've never thoroughly looked at the case, the patient will often win the appeal. So this was, first of all, a situation I created. I caused part of the problem. PT and OT are both in on this patient. He's, let's just say, of advanced age. He's had cancer. He's been treated with chemotherapy. As a result of the chemo, unfortunately, he's ended up with peripheral neuropathy of his distal lower and distal upper extremities. Fairly significant with a lot of muscle wasting. Bilateral AFOs needed. Thenar, hypothenar eminences gone. Intrinsic muscle weakness in his hands. So really devastated him. But fortunately, he's cognitively intact. We've had him for some time now. We've had him for uh, 3 months now. So he's actually into his second cert. And I had recertified him, and the plan was I put up initial plan for 60 full days. So when I saw him for the last recertification 30 days ago, he had made significant progress. And I used 3 standardized tests because what was happening was with him on any Medicare form with these standardized assessments that include section GG, oftentimes they're not sensitive enough to showing a lot of progress. So standardized tests are much better. And so I used 3. I used the Tenetti, the 30-second chair rise, and the timed up and go. And I generally try to describe those as to what areas of concern I'm looking at. And I've got the normative data to back me up what they should be at. So I like those tests. So as of 30 days ago, I was able to demonstrate from my last 30-day reassessment and the previous certification progress. But over the last month, he's plateaued. And really, at this point, it's his problems with his peripheral neuropathy. Now, here's where I did a mistake. I, without looking, I had assumed that OT was out because basically the guy is doing his own thing. He had an aide in to help him with his ADL, especially showering, but he's doing remarkably well and probably could safely shower on his own with the use of a tub seat. And I really didn't have a problem with discharging him, but I didn't realize OT was still in, and their last note was a week old. And so I told the PTA to go ahead and issue the notice of Medicare non-coverage and explain to him that today would actually be his last visit. Well, I created a whole poop storm. Let's put it that way. And anyway, he was not happy at all. I have explained to him now. Today was for the third time what skilled therapy services are. And as you know, I have a lot of experience in that, and so I'm able to break it down between the reasonable progress and the necessity of ongoing care. And I tried every which way I could to explain it to him, but he was having a really hard time grasping it, or didn't want to. And he could have a little bit of that chemo brain fog, that we often have to deal with some of our patients. But he's pretty sharp, though. I think he got it. He just doesn't want to get it. And we have those patients, too. So, anyway, I didn't realize OT was planning on going out still. So, I had made a mistake. and he got upset, and he took the notice of Medicare non-coverage. He contacted Medicare, and they approved an extension. So now it's my word against theirs, against Medicare's. And he's going under the assumption that just because Medicare said continue home health services, that means everything for as long as Medicare says. And really, that's not the case. Now, patients have the right to appeal maintaining Medicare, but that does, or home health, but that doesn't mean you go ad infinitum, you just keep going. You still have to justify ongoing care, and you still prepare for discharge again, and they can still appeal the decision again. And so what I did was I went in there and I told his family member who's a HIPAA contact who communicates with him. I told him that I was going to go in with an open mind. I was going to take a good look at him because one of my assistants has been seeing him. And I got in there and put him through the tests, and it was clear on the measures that required strength, like gross strength, there had been some improvement. But one of the requirements of Medicare is that therapy services cannot be provided for only strengthening. You have to show a complexity that requires a therapist is necessary to address the strengthening. And with him, previously he had had some chemo-associated cardiovascular endurance insufficiencies, which were addressed over the course of time through exercise. He's gained a lot of conditioning capability. And so, that's one thing we look at with strengthening. And of course, another thing would be technique. Can he do these exercises safely and effectively without injuring himself? And lo and behold, he's doing his home exercises, regularly and carefully, and he's doing a good job. So in the performance measures that look strictly at strength, he was doing much better. But when it came to balance, because of his peripheral neuropathy, and he's also hard of hearing and he has to wear hearing aids, I noted that he could be experiencing ongoing issues because of the common nerve associated with both balance and hearing, the vestibular cochlear. So anyway, with that said, I'm trying to remember if I named that right. I think I did. I haven't named my cranial nerves in a while. So anyway, because Medicare had given him an extension of home care services, and really OT was planning on extending anyway, I still have to plan an exit. Now this guy's unhappy, and I inadvertently created a snowball effect that caused his consternation and created a little bit of a difficulty for my work. So I've got to juggle satisfying Medicare, dealing with the patient's dissatisfaction, dealing with safe and effective discharge. So this is how I handled it. And this is the beginning of my note, which is sufficient to tell a narrative as to why I'm still going to be planning a discharge. And this is something I sent to the doctor too, so the doctor understands the reasoning behind this. 30-day PT reassessment was performed today. Below is a summary of the findings. At present, his chief deficits are underlying impairments of medical origin that are non-modifiables by PT, including his somatosensory loss, his vestibular awareness loss, and the muscular control loss due to chemo-induced peripheral neuropathy. His status has been stable, and his cognitive and cardiovascular status have been stable as well. Given these factors, he is not demonstrating at this time the need for ongoing PT for rehabilitative services, nor the complexity necessary for maintenance therapy services. PT will be continuing *2 visits to ensure compliance and understanding with a safe and effective home exercise program to assist in the maintaining his status. This was explained to him, and he acknowledged understanding of this plan. One of the things that had come up, this is just an aside, by my boss, who I have high respect for, and she's been dealing with compliance issues for a long time too. She said, did you make sure the documentation really showed that he knew discharge was coming? And my PTA is good, and she had documented, that she had communicated discharge with him and that he was upset. But we didn't really have good documentation to show that we had informed him of the discharge decision and that we were proceeding with the discharge. And so anyway, that's why I put that in there, and giving him a little extra time, make sure he's got home exercise program down. Okay, so anyway, this was explained to him, and he acknowledged understanding of this plan. I worded it that way on purpose. And then I finished off with this. Should he, after the culmination of chemotherapy, begin to show signs of distal neurological regeneration and capacity for improvement of his distal extremities, then further rehabilitation is warranted. Should he demonstrate a significant loss in functional mobility in the future, then restorative attempts should be made by PT. And then I went on to status stuff and explained what that status meant, and we're getting out. So just because Medicare gives you an extension doesn't mean ultimately you just keep going ad infinitum. And since OT is going to continue anyway, the Medicare saying continue home health services, they'll still be fulfilling that, but then they're going to have to make an exit at some point. And if he appeals again, then we'll just have to deal with it. But that doesn't mean that they just continue for a whole cert. They maybe extend for a little bit, they prepare him again for discharge, he appeals again. It could be just one of those. But anyway, that's how I dealt with it. Any comments, suggestions, similar experiences are always welcome. Anyway, I hope you're having a great night. I'm getting ready to do a little shopping before heading home, and then the weekend. Very excited about that. Anyway, take care of yourself, and God bless.